Today we're going to talk about this idea of infectivity. R naught is a number that is thrown around all the time. I will talk about the nuances in dealing with this number, because as we know, it's not all just one number. So to start off, there's a recent article here saying that, maybe this thing is more infectious than we thought. So now they're saying 5.7 instead of, 2 or 3. They're saying the previous data was incomplete. So if you look here at the bottom, they talk about sort of some numbers. They do some calculations. And so, they're saying instead of taking 6 to 7 days for an infected people to double, it only took 2 to 3 days. And they're saying that the reason is in Wuhan, where it was the epicenter of the outbreak, the people were just overwhelmed, and so their data collection is actually very poor. Outside of Wuhan, they had a lot of testing capability, and they're testing everybody that came out of Wuhan, not everybody, but a lot of people. And so their data is actually more accurate. And they're saying maybe that's why, these figures that we use, right, we're actually going to be different. And so that's very interesting in that the very end, right, they talk about something called herd immunity, which I'm sure you've all heard about. And they're saying that herd immunity could actually be a different number. Let me see where that is. Right here. So let's keep on going. And then so we're going to talk first about sort of what this figure is. So R naught, basic reproduction number, some people that appear say that's actually incorrect, but R with a little 0 at the bottom. The first I've heard of it was my friend was in Singapore telling me, hey, this R naught is, higher than we thought. It's actually pretty bad. This was over a month ago. I was still in the US then. I was working. And the idea is that, hey, this thing is pretty dangerous, pretty infectious. I think, your models may be underestimating it. So here you see how they're all calculating this thing, but the curves are different, and it depends on BHSP. So episodic risk, behavioral homogeneity, there's all these different risks, and so that's why it's not quite so clear how R naught translates to a curve. But if you just simplify it and sort of say everything's the same, this is what we've been seeing, right? When they say flatten the curve, we want this top to not be as high. So that's what, if we could change this number, right, then we might be able to do something. So if you see the higher the R naught is, the higher the peak is. If you look here, it tells us a little bit more about the nuances, because it talks about developed versus undeveloped countries, and somehow R naught is different. And you're like, does that make any sense? This virus, as we know, it doesn't differentiate between rich and poor, black or white. It doesn't really care. It infects everybody all the same. Why does this make a difference, though? And that's because R naught is just not solely about the virus. So R naught is supposedly a measure of infectiousness. How many people will get it? And if you look, we see different diseases that have, hit the news, shall we say, recently. There's Ebola, which is pretty deadly, but the R naught is not actually that high. So that's why when the cases came to the US, they thought it wasn't that big a deal, and actually it ended up not being a big deal. Influenza, it's above 1, right? H1N1 regular influenza. Measles is pretty high. It's probably the highest thing that we know of. MERS was around 1. The idea is 1 is the cutoff, and if it's below 1, it's not going to become an epidemic, and MERS definitely did not. Polio is pretty high, right? SARS, somewhere. Smallpox, chickenpox is pretty high as well, and this is what their estimate is from the University of Michigan. Now, if you look at modes of transmission, we're all taught to say airborne is the most worrisome. Well, polio we saw was pretty high, and it's through feces or mucus. Doesn't seem to be that high risk. Well, the idea is polio is pretty infectious, as in you just need a little bit of exposure and you could get it. If you look at airborne, it's TB, chickenpox, measles. Some of these are pretty contagious, but some of these aren't that contagious, right? Tuberculosis is pretty contagious, but I was in Africa and I didn't wear a mask and I didn't get it. Just because you're exposed to it doesn't mean you get it. Actually, TB has been around for a long, long time. Hundreds of years ago, it was called consumption. And the idea was that if your immune system worked well, you weren't going to get it. And if your immune system didn't work well, you were liable to get it. We actually believe that today as well. We think that if your immune system working pretty well, your chance of getting it actually isn't that high. We still see people in the hospital with TB. We do tracing if it's been missed, shall we say, and a lot of people have been exposed without proper protection. But it doesn't mean that just because you've been exposed, you'll get it. A lot of us in the healthcare system have been exposed and we have not gotten it. So let's go back and talk a little bit about this concept of R naught. So some people call it the basic reproduction number, but technically defined as the average number of secondary infections caused by one infected individual during the infectious period at the start of an outbreak. Wow, there's a lot of different terms here, right? So one is it's at the start of an outbreak, meaning everybody's susceptible. So that's pretty good for us because, it's the start of an outbreak here for us, so it should be pretty easy to figure this thing out, right? Okay, well, it's a number of secondary infections caused by one infected individual during the infectious period. How long is somebody infectious for? I don't think we know the answer to that. 14 days is a standard number that people throw out, but nobody knows whether that's true. There are lots of studies from China showing that people still test positive after they've been cured, whatever that means, right? Or people could test positive again after they've been cured and they tested negative. Did they catch it again and they just weren't immune? Did it reactivate? What does this mean? I don't think we know. And then the thing is, secondary infections. How do you get this? How do you know who has been affected? Well, one way is contact tracing, right? So you hear all this talk about contact tracing. Contact tracing is useful in many cases, and one use that has been very successful has been in South Korea, warning the people who have been in contact to get themselves tested. Contact tracing is also useful if you have data on it to see how many people got infected from this one person who was infectious, right? That's a way of calculating R naught. That's a pretty good way. The other way is, a lot of times they use modeling and all these simulations, so that's beyond my scope, mathematical models, statistical models. And so basically, it's this sort of guess. It's a calculation. Sometimes they did the calculations on sort of enclosed environments, like the Diamond Princess. Everybody stuck on a boat. The small population, they knew how many cases, they knew how many cases should pop up depending on what R naught is, right? And then they just sort of did calculations and simulations to make their data fit. There's a different number actually that's called a case fatality rate that we don't want to get confused, right? Because just because, have a high R naught doesn't mean everybody's going to die. In an epidemic, many people get it. The lethality of it is something different. So the case fatality rate is talking about the lethality. So now there's a few nuances in talking about R naught. So one thing is that if you go back to this curve saying developed countries versus undeveloped countries are different, what we know is hygiene matters. So in the US, you could already see a difference, right? So in places like New York City, Manhattan, I think some people may think it's a very rich city, but there's a lot of poverty going on. There's a lot of people cram 6 people into a 2-bedroom. Maybe that's not even bad in New York City. But they're just very closely packed. And in California, it's just not as closely packed. And the idea is that in developing countries, people are more closely packed. And we see that in Singapore. Because, when you pack people close together, 10, 12 to a dormitory room, right? Then it's just your chance of getting it is just higher. There's no such thing as isolation. I mean, this idea of 6 feet is just, again, it's a magic number somebody picked out of a hat, right? But I think the idea is the farther you are away, the less likely you are to get it. There's some distancing that matters. And so we know that the R naught is not intrinsic to the virus. It has other variables, like how long are you contagious for? If you're contagious for, a few days versus a few weeks, it makes a difference. We just talk about, duration of contact, if you're near somebody for a prolonged period of time, then you're also more likely to get it. Like, I guess Andrew Cuomo's wife, right? I think actually not Andrew Cuomo, his brother. He was the newscaster on CNN. But, his wife ended up getting it, or so it seems. And, she had to deliver food for him. He was isolated in a room, but, she's just in such close contact. These precautions don't work if you're always with somebody. If you're committed to living in a hospital, living next to patients, you have no break at all. I think almost all the precautions in the world don't work. N95 is not 100%. There's nothing that's 100%. The amount of time you spend in contact with somebody is important as well. And then the idea of distancing, right? We're seeing that the curves are changing, and we think it's because the R0 is changing. What we mean by this is, we mean that by socially distancing a lot of people, we're actually changing the infectiousness of the virus. Because it's still the same infectiousness, but we're not giving it less of a chance to act, shall we say. And so, you may have heard this term called herd immunity. Here they call herd immunity, HIT, right? So the definition is that the threshold. How much of the population has to be immune for the disease to be stable, right? It's not saying, oh, yeah. Once you reach the threshold for herd immunity, all this is going to go away. No, it's not saying that. It's just saying have a threshold for the disease to be stable, right? So the idea right now is the disease may be coming down in many places around the world. In some places it's very low. But that's because we're doing a lot. We're shutting down places to do this, shutting down businesses. If we were to open stuff back up and nothing's changed, then a lot of people would get infected again. A lot of people would die. So it's a simple calculation based on R0 to calculate herd immunity. So the reason R0 is so important and why we keep revising estimates and why we have to see what we could do about the R0 using different measures is because it matters to your herd immunity. So here it talks about, they need a new herd immunity to be 82%, right? To stop it from spreading, not 60%. So by some simple calculations, just going back to this idea of how to calculate, for the 60%, we calculated R0 of 2.5. For the 82%, we calculated R0 of 5.6. I think the question really is, what is a sustainable R0, right? As in, we can't shut down everything forever. We also can't just let people die. How do we reach a balance? Are there measures that are more important than other measures at keeping this disease, called the coronavirus pandemic, at bay? I think testing for the virus would be a very good way of decreasing the R0. We just give the virus simply less chance to act. We catch it sooner. It's like a criminal that's stealing. Many places have CCTV, right? Closed circuit TV. They could catch them after the fact, but it doesn't really help that they're still going and committing crime. Can we catch it sooner? That's where testing comes into play. Vaccination, that's one way, right? Because instead of letting people just become immune by having gotten it, we're artificially increasing immunity by vaccination. It's just that that's so far away that I feel like we can't rely on it right now, at least if we're talking in the next few months. So this is a short talk about R0, the number we use to define infectiousness, the sort of nuances in how we use it, and the relationship it has to this concept of herd immunity.